am Dr. Ben Gonzalez, and this is Dr. G's Corner. Currently, medical physicians struggle with recommending CBD as an adjunct to traditional treatments. Whether it be for pain management, anxiety, surgical recovery, neurodegenerative disorders, gut health, or just basic metabolic balance, physicians need studies and standards of care in order to be confident in their recommendations. With restrictive FDA regulations, old and archaic medical board standards, physicians' hands are tied. This leaves you, the consumer, tossed into the wind of over-marketed and poorly regulated over-the-counter products. So what do physicians think? Well, first, no one wants to hear a physician complain. It takes away from the confidence of the patient in the provider. And to be clear, your medical physician truly wants to help you. Physicians are limited by many things. First, by their education. Second, by the patient, what the patient is willing to do. And third, and this is a big one, by extensive and almost debilitating government, insurance, and legal pressures. I do not want to dwell on the negative aspects of working as a physician. As I said, no one wants to hear a physician complain. Rather, I want to introduce some common challenges physicians and patients have when dealing with the recommendations and the use of CBD in the treatment of medical conditions. Government and insurers think that time spent cutting patients and writing prescriptions is more valuable than time spent thinking about patients. In other words, surgery and drug recommendations in a short and limited appointment time is worth more than researching alternative treatments. And when I say alternative, I'm not talking about unfounded, poorly studied treatments. I'm talking about medically sound treatments that fall under the art of medicine. Medicine is a science, yes, but it is also an art involving interpretation and analysis of the literature. The art in medicine comes in how the physician applies the known literature to the individual patient. On the subject of CBD, there is a great deal of medical literature support in the safety of CBD use. We know that the body needs CBD for overall health balance and has a natural CBD system, like the endocrine system of hormones with molecules and receptors for those molecules in the body. What we do not have are standards of care for the use of CBD. We also do not have a full understanding of how CBD interacts with other medications. We need more studies, and this will take time. There is a role for properly sourced and purposeful application of CBD in gut health, surgical recovery, pain management, nerve diseases like multiple sclerosis, seizure disorders, weight loss, anxiety, depression, and many autoimmune disorders like rheumatoid arthritis, Hashimoto's thyroid disease, and even in the treatment of COVID-related lung disease. I will be speaking extensively in future Dr. G Corner discussions on this subject and the specific use of CBD in medicine. And for more information about the medical use of CBD oil and sourcing a high quality and specific type of CBD for your condition of concern, you can message me directly on Instagram at Ben Gonzalez MD or Ben Gonzalez _MD, or you can also call the clinic to set up an initial telephone consultation at 301-622-2722. Gentlemen, I hope that helped, and happy holidays and wishing a wonderful, improved new year.
Happy holidays, Doc. Thank you.